Gender affirming care can take on many different forms, from making a person feel respected by others to medical treatments to match a person's physical state with the gender that they identify with. Let's talk about it. Hey everybody, it's Dr. David. So with all of the talk and news and laws about gender affirming care, I thought that this would be a good opportunity to actually explain what that means, because there does seem to be a lot of confusion and misunderstanding, and it's good to understand what we are talking about. Now, I've been looking at these laws, and we know that in many different states now that gender affirming care is being restricted, especially for minors, for the youth. And I've been trying to think of how can we all think about this to really help ourselves understand everything. And one of the questions, or a series of questions that I've come up with when it comes to any of these bills, any of these laws, is as following. How does this bill or law affect you or your family? How does it affect your community? And also, who does it hurt and how? Ask yourself those questions. Maybe they'll help clarify in your mind as to what the actual right thing should be. Okay? Now, why am I talking about this? Simply, I'm a pediatrician. I have patients who are dealing with this now. I have family members who are dealing with this. And so this is an important thing both on a personal level, but also I take care of patients no matter which direction that they're coming from, where they stand politically, religiously, and everything else. I was taught early in my career, the most important patient in the world is the one that you're talking to right now. Something that I live by. Maybe that should be true for whoever we speak with as a whole, not just doctors. So let's first talk about what the definition of gender is, okay? It's the socially constructed characteristics of women and men, or boys and girls. So who as a society, socially, what do we associate with maleness and femaleness? Okay, and that's a definition of gender. And of course, if a person doesn't feel that way, it's who they feel like relative to those social norms. Okay, maybe norms isn't the right term. The social way, the way that society is viewing things. Now, this is not the same thing as biological sex. This isn't are you XX, XY. This isn't who you were assigned at birth. Okay, gender is different than that. Now, at a fundamental level, let's talk about what gender affirming care is, okay? And it involves the affirming, which of course that's where it gets the name from, of a person's gender identity and creating a safe space for them to explore how they may want to express their gender in this world, okay? And some people means that they may feel like they are matched in terms of their gender, but they don't feel the need to do anything. They just know who they are. Maybe they let their friends, their family know. And of course, there can be much more to it. Now, it is very important to the mental and physical health of the individual that gender affirmation takes place for them. Everybody wants to feel respected. Everyone wants to feel a part, wants to feel whole. And this is something that can make a person feel whole. And isn't that what we all deserve? I think so. Okay. Now, of course, gender affirming care also involves knowledgeable professionals, friends, family members, in order to help them work through this. Because, for sure, it takes a village to raise anybody, to help a person feel it. But this isn't particularly a particular situation because it takes a lot of people in order to make that person feel whole. It can't just happen from in here for them to be complete because everybody interacts with the outside world. Okay. Now, most individuals will seek this type of care because their sex that they're born to, again, as I said, doesn't match. Now, this mismatch is diagnosable, and it's a condition. It's a psychiatric condition called gender dysphoria. Okay. When a person doesn't feel that they are matched properly to themselves in their own mind and in the minds of others. And untreated, we know that it can lead to anxiety, depression, suicidal thoughts, as well as suicidal actions. And that is why this is so important. There are people who are being devastated by their gender dysphoria and who are taking their life. That's so sad. Okay, now, because no two patients are the same, no two people are the same, gender affirming care really is different from every person. It's really a holistic type of concept. because it affects all aspects of a person's life and who's around them, medically, physically, psychologically, and how people are interacting. Okay. And so all of these different types of services could be available for transgender and non-binary individuals. So let's talk now about what the different aspects of gender affirming care is. Okay. And recognizing that the first step for most has nothing to do with medical. Okay. It's affirming who that person is. Okay. And the most fundamental step is when a person just feels validated, feels respected by others. That's a care that we can all give to another human being. Realistically, whether we agree with them or not, it's still respect of another person. Something that I see is pretty lacking in society as a whole, but we all can do better. Why? Because we want to be respected ourselves. We want our beliefs to be respected by ourselves. Can't really expect the person to accept our beliefs if we're not accepting theirs. So that is important. Now, there are non-medical forms. Okay, of course, using a name or a pronoun that a person associates with. Okay, I don't see how it's hurting somebody by referring to them what they want to be referred to. Okay, for me, I'm David, but if someone calls me David, it doesn't kind of feel right to me. So that's part of affirming who I am, is I'm David. Now, if a person's name doesn't match the gender that they identify with, they may want to change that. And of course, if a person feels like a she, to calling them a he, especially if you know that that's what a person wants, can't we just respect what other people want and what makes that person whole? Okay. Now, of course, there are other things besides names and pronouns. How a person wears their hair, the clothing that they wear, right? How they accessorize, if they choose to use makeup or not. All of those things also are kind of part of that defining of the social, societal norms, if you will. Okay. Now, it also could be that the individual, in terms of the care for themselves, coming out, explaining to people or telling people, hey, I am non-binary. I am transgender. I feel like my body, my existence is that of a male or a female. Will you respect that of me? Okay, and that's a very powerful thing for people to do, and something that a lot of people can be really, really scared about. Okay, now, the second thing, if a person chooses to do medical transition, it depends on where they are in their developmental life. So early on, the first step that's usually done from a medical perspective is a puberty blocker. Blocking the hormones. This is done early in puberty, before things have started to develop, like chests, like Adam's apples, facial hair, things that would be outward. Okay. And so there are different types of puberty blockers. These are different types of hormones and things that just, it arrests the puberty development. Okay. If they're stopped, puberty will proceed. So this is not an irreversible thing, but a lot of times it'll give the younger individual kind of a timeout, a pause for them to maybe recognize what it is and who they are and what they want to do to feel most of themselves. They may choose not to go ahead and create other physical changes, but still that's okay with them. And that should be respected too. Okay. Now, if a person does then proceed to do something further, usually the next thing that's done are specific hormones. Okay. So if a biological female, their gender identity is that of a male, they would then typically, and this happens much later in puberty, this is like at around 16, 17, 18, where they would typically, a biological female would take testosterone. Okay. And a biological female who identifies as a male would take, I'm sorry, let me say it differently. A biological male who identifies as a female would be taking estrogen, but also testosterone blockers like spironolactone. Okay. And these again are to help develop the secondary characteristics that they associate with. So the puberty blocker stops the progression of what would have naturally happened. And then the hormone replacement, or the hormones themselves, are to help develop to who they think they want to be. And as I said, one's done in early puberty, one is done as later puberty. Now, the next option is medical procedures that are surgical. Okay. It is so important to understand that this is almost never done on a child. These are things that are done for adults who choose to make that last step. Okay. And that can take many different faces. So some may choose to do things with their face, whether they're cheekbones or lips or things like that, eyebrows, procedures, etc. Right. Some may decide that they, in terms of breast development, if they wish to have larger breasts, or if they don't have any breast development because it's happened. And then there's, of course, procedures to reduce them. And of course, there are the procedures that affect their genitalia. Okay, and that's obviously, again, a person's choice. And I know there's people who decide that they want to surgically affect the top because that's what they're going to be seen in the outside world with. But in the privacy, maybe they don't want to change their genitalia. Or maybe they do. That's their call. And it's important to let people feel who they wish to be. And in the concept of medical freedom and medical rights, everybody should have autonomy over who they are and who they identify with. Okay. Now, as I said, not all transgender or non-binary people will go on to those surgical steps whatsoever. Now, another question that, of course, comes up relative to this is, well, what's the medical proof that this is helpful for the individual? So I did gather a few studies from the past few years. So these are newer studies that I thought would be a good time to present them to you. Okay. So one of them, it was a study called Mental Health Outcomes in Transgender and Non-Binary Youth Receiving Gender Affirming Care. And this was from 2022. There were 104 transgender and non-binary youth in this one study, and they either started puberty blockers or affirming hormones, but the other group did not, okay? And they looked at them for 12 months. Over this 12-month period, those who did receive the puberty blockers or the hormones experienced a 60% lower odds of getting depression and a 73% lower odds of suicidality. Super important stuff here, okay? Then there was a 2019 study published in the American Journal of Psychology. And I have links for all of these studies. If you want to go through the details, they're down in the description below, so you can certainly look at them. But there was 2,679 individuals over a 10-year period, so a long-term study. And they annually tracked them and asked mental health types of questions. And these are people who had gender-affirming surgery. Okay? They found that the need for psychological care, for mental health treatment, reduced 8% every year that passed after their surgery. So 2 years out, 16%, 3 years out, 24%. So the longer that a person who has had a surgery to affirm their gender, the better that they feel, and it keeps on building on themselves, which is great. Okay. And then I'll quote one more study from 2021. This was published in the Journal of American Medical Association. And in this, there were 20,000 individuals, and they wanted gender-affirming surgery. Some of them were able to. Some people were not. And it doesn't mean that they weren't because they were restricted to finances, timings, other things like that could have been involved as well. But it's just that people who were able to compared to those who were not, but everybody wanted it. Okay. What they found in this was that those who had surgery experienced a 42% lower psychological distress, and their suicidal ideation went down 44%. Now, of course, those numbers are going to be different from study, and every study will have different data. And one of the important things that I've learned is that you look at a bunch of studies as they come in and look at all of them in order to be able to make a medical decision if I'm going to counsel somebody. Okay, so based upon the medical information that I have, that I've reviewed of the extensive literature that's out there, gender-affirming care is not just helpful, but it could be life-saving. So I guess we all now have that question. Are we going to take actions? Are we going to support people's mental health, their potential life, or are we not? Who are we helping with these things? Who are we hurting? It's a good question, right? Have a nice day.